观众朋友晚上好，欢迎收看最新一期的子天访谈录 SD Talk Show， 我是子天 Skydo。Welcome to SD Talk Show. Hi, Dr. Mattioli.
Hello, Sky. It's always great to see you. Thanks for having me.
Yes, me too. Please introduce yourself to our audience again.
Sure. Yeah. So I'm Fred Mattioli. I'm an ophthalmologist here in Houston, and I've been in practice for about 23 years. And yeah, quite some time. So we've learned a lot and do a lot of different types of treatments, mostly to help people, of course, see better, but to see better without any additional needs, such as glasses or contact lenses. So that's what we've dedicated our practice to.
I think the audience know Dr. Mattioli because from me, last year, I'm so happy he did the smile for me. So my eye is perfect, amazing, 2020. And I want to know how many cases you already done?
Oh yeah, so we've done over the years, probably over 70,000 laser procedures.
Wow.
All different types of prescriptions and nearsighted, astigmatism, farsighted, people who need reading glasses. We see all types of people, and the procedures we do really help them.
So I think the audience want to know more some details about the eye vision. They have LASIK. They have a LASIK for near sight, far sight, right? They have a smile correction, also have ICL. So what's the difference?
Yeah, that's a great question, and it's definitely can be a little confusing when you hear all these different terms and all these different procedures. So just rest assured, first of all, that we will examine everything completely and make sure that that we have the best procedure for you. So really the biggest differences, the way to think about it, is either treatments on the outside of the eye or treatments inside of the eye. So that's two categories. Makes it very simple. Outside are things such as LASIK, SMILE. I had LASIK myself a long time ago, more than 20 years ago.
Wow.
SMILE, so these are PRK. These are all laser treatments, LASIK, SMILE, PRK, that can be done with lasers on the outside of the eye. The typical procedures inside the eye are lens implants. So we have things like EVO ICL. We have single vision lens implants. We have double distance and intermediate, so two types of lenses. And then we have the trifocal. So we have different types of intraocular lenses that can provide different outcomes for whatever your needs might be. So younger patients are more likely to have LASIK or SMILE or ICL. And after about 45, even though we can still do LASIK, depending on your prescription and whatever your needs are, that's where the lens implant starts to come in. So typically on the outside is more laser for younger people, even though we can do for older. And then the inside the eye is more for older patients, but also we see some younger patients that need it.
Wow, perfect. So I know a lot of patients wear contact. So can you talk about the wear contact? The eye will get what kind of the better result?
Yeah, so that's great. Contact lenses have a great use when you're younger, sports. That's how I started wearing contact lenses at age 12. So there's a lot of times that can be better than glasses, right? The problem with contact lenses is that it is a foreign object on the surface of the eye. And so after years and years of wearing these, you can run into problems. And pretty much all the studies show that after about 5 years, you're likely to have more dryness from contact lenses than from an eye surgery. And I always tell people, even if your box, the contact lens box, says it's okay to sleep in contacts 30 days, these extended wear, I tell them, please don't do that. We have seen so many patients that have gotten infections from their contact lenses, especially if they sleep in them. It's almost like 10 times more likely to have an eye infection from your contacts if you sleep in them. So obviously it's better not even to need them. And so I think those are two big reasons to, if you can, avoid contact lenses and have some type of surgery instead.
Yeah. Why I ask you this, because I wear contacts before all the time, because I like some color, always change different. But I always feeling have something in my eye. Then maybe, like you say, for future we'll get an infection. Also, another reason why I make a decision want to do the smile, comparison the price. the contact is very expensive. For the daily one, probably a month is 200, more than that.
Oh, yes.
Yes.
So I haven't worn contact lenses in 23 years, so I don't know what the prices are, but I do know that patients do come in
Yeah.
because of prices. And most
Yeah.
of the time, it's not just the contact lenses, because you also have to have some glasses to wear when you don't have your contacts in. So then you're spending money on glasses again. Glasses and contact lenses. Yes, and for a typical LASIK or SMILE procedure, the monthly, if you prefer to finance it, the monthly
Yeah.
payments are even less than your contact lenses.
And it's take forever. So I think another audience concern, they have the fear and maybe the result, it's not too good, not perfect. So can you talk about how many percentage for the succeed?
Oh, yes, that's a great question, because we still find fear as the main reason people don't come in to get treatment done. They're great candidates
Yeah.
for it. They may not even know that. They may be told they're not candidates. And then when we see them, when they finally get enough courage to come and see if they're a candidate, get the treatment done, the number one thing we always hear is, why did I wait so long? Right? So it's a very straightforward process that we've perfected over 25, 30 years of lasers. So it's not new, and the results are fantastic. I mean, they're excellent. Why does something last 30 years? Because the results are good. So the percentages are very, very high. Most patients are 98% or so, driving without glasses. Most of them are 20/20, and we can't always guarantee that depending on the eyes and what your particular needs are, but things don't last, Sky, if they are not excellent. So we're very happy to be able to provide these latest treatments that do provide excellent results. And that's true whether we're talking about LASIK or SMILE, ICL, or lens implants. I mean, really the biggest factor is being the right patient. So that's where we take our time to examine everybody individually and make sure that they're a good candidate. So, yeah, the things with contact lenses, really, or glasses, is you're paying monthly, yearly, over and over and over, whereas you could do one laser procedure, essentially a permanent procedure, and be done.
And about the result, I'm very happy about myself. Some patient will thinking about maybe the night vision not good at daytime. I say no, it's the same, exactly same. Also, the people will question about after the procedure, they need to rest at home, or they can back to work the second day. So can you explain each one? Maybe SMILE, maybe LASIK.
Yeah, sure. It's a great question too, because we all need to work. We need to get back into our routine. So you actually spend less time, first of all, in the procedure room. Most of the procedures are about 15 minutes. So you're going to spend more time ordering your contact lenses, waiting for them to arrive, getting your glasses made, choosing a pair of glasses. I mean, you're losing a lot of precious time. So with the procedure, pretty much in 15 minutes, you're finished. So you go home that day and rest, and almost everybody is working the very next day. Depending on the procedure and what your occupation may be, you may want to rest a day or two, but those are things we go over. But really, almost every procedure you can start to see better as soon as you sit up in the procedure room. And by the next day, most people are already driving. And as we mentioned, most are already working. It's okay. I have some patients that like to come in on Friday and rest over the weekend and go back to work on Monday, and that's totally fine.
So also patient wanted to know, so what's the schedule for the procedure and what's the schedule for the bed appointment?
Yeah, so actually for most of our vision evaluations to see if you're a candidate for one of these procedures, it's complimentary, because we're here to help. So we don't want barriers in front. So we offer consultations, the vast majority of types of prescriptions, nearsighted, farsighted, astigmatism, these types of things, just to see if you're a candidate for one of these procedures. And that's the best way to just find out. Once we do that and we figure out with you what is the best procedure for you, then that gets scheduled almost really within a week.
Awake.
So yeah, and then that particular day, again, is you may be there an hour in the office. The procedure's only 15, 20 minutes maybe. And from there you go home and rest. And again, the next day you're pretty much back at work.
Yeah. And also I have a question. What kind of people can do LASIK or SMILE? There have some kind of people told me, oh, my eye is not qualified to do this. So maybe what's the reason?
Yeah, and that's great because most people are told that they may not be candidates or that their prescription is still changing and all these things. Well, we have very specialized equipment in the office to examine the eyes and make sure that you are a good candidate for these procedures. And the main objective is to provide the best outcomes according to each procedure. The ICL is a lens implant, and just like LASIK and SMILE and even my cataract surgeries, we use topical eye drops. That means eye drops, topical anesthetics. So we just put drops on the eye to numb the eye. Okay, so you don't need to have general anesthesia or a lot of anesthetics that make you feel bad when they wear off. These are just eye drops. And the ICL specifically has a very wide range of nearsightedness treatment, so myopia and astigmatism, which can be corrected in the same lens. And that procedure is it's probably about 20 minutes for both eyes. That's both eyes, again, with topical drops. The nice thing about the ICL is the clarity. It's an optically very, very clear, almost like a contact lens, but instead of outside the eye, inside the eye. Okay, so you don't have all the problems that you have with regular contacts. So this will go inside the eye. The EVO is the newest type of ICL. And the reason it's new is because now ICL has become one-step procedure instead of two. So it's even better, and the results are even better. So yeah, the EVO has been a really fantastic development in ICL. So ICLs have been around since 2005. The EVO came out, the EVO version of ICL maybe 2 years ago.
2 years ago.
So, but worldwide it's been in use 10 years. So the results are fantastic. We're very happy to be the provider for ICL.
So I know mostly it's a high degree that people can do SMILE, so they will select ICL, right?
Right, and so yes, that's correct. Sometimes the cornea, the outside part of the eye, isn't good for a laser. The shape may not be the best condition for a laser procedure. So that's why ICL can even be the first choice, even if the prescription is low. And we can treat with ICL from 21 years of age, sometimes a little bit younger, but 21 years of age up to 45. So it's a big range and a very wide range of myopia and astigmatism that can be treated.
So how about older than 45, the people? It's more complicated, right?
Yes, so with patients who are older, instead of the ICL, which is a lens implant, we use a different type of lens implant. And that is one that is either a bifocal or a trifocal type. And the nice thing about that is at 45, one of the problems that we run into is our near vision, what we call presbyopia, so we can't focus up close anymore when we do this. That happens after about age 40, right? So you have to use reading glasses, or if you already wear glasses, you have to wear a bifocal in the glasses. And so instead of that, we actually have lenses intraocular inside the eye that are bifocal or even trifocal. So that means you can see far, intermediate, and near. So you're driving, your computer, and you're reading, all with one treatment.
Also have some patient very special. One eye is near side, one eye is far side. So they still can treatment, right?
Yes. Farsighted, nearsighted, astigmatism, presbyopia, which is the reading problem. Those are the four main problems in a healthy eye. Sometimes we'll have eyes who, as you mentioned, can't do SMILE or LASIK, so we do the lens implants. Those are other types of medical conditions that we also treat. It's not as common, but we do see a lot of those types of patients who aren't candidates for some of the more common type procedures like LASIK or SMILE or EVO.
So I hear so far Dr. Mattioli can do all the treatments.
Whatever
the age and whatever the eye, the problem.
Yes. We have a wide range. Typically, we see patients that are 18 years and older because that's when you can start 18. To do something, whether it's a laser or something. And some of my oldest patients are in their 90s.
90s?
So there is a crossover between the different procedures. So that's why it's always best. Sometimes people will, want LASIK because they heard of LASIK, but you came in and we saw you and you're a better SMILE candidate.
Yeah.
So we talked to you about SMILE. Sometimes people will want SMILE and we say, well, you're a better EVO ICO candidate. Sometimes people come in and they have cataracts and don't know it. So we do a cataract surgery. So the age is not as important as the condition of the eye because we have something that can fit everybody.
That's perfect. Also, everybody don't want the eye has any problem, right? But we help for treatment. So I want you give some junior, maybe school or kids for now, because we have many patients as parents. So they have to protect the eye from the young to evolve future, need to do many surgery. But if you have the problem, you can come to me. Then before that, I want you give some suggestion.
I think that's really, really important. We are actually going through really an epidemic of myopia. We are seeing nearsightedness far, far more in younger children than we did ever before. And so that's very important. And there are doctors, I have some colleagues actually who do specialized treatment for younger children who already are having myopia progression, so nearsightedness. So as we grow, our eye is going to grow as well, right? And so that makes us more and more nearsighted. So it's been discovered some types of contact lenses techniques that can be used to help reduce that myopia progression. So it won't make it go away, but it'll keep it from getting worse and worse and worse as they become teenagers and adults. And so that's very important, myopia control. One of the things that has been shown, actually out of some studies in Asia, very important studies that showed the rate of nearsightedness, the amount of prescription a child may have, is worse if they're mostly inside versus the group of children that were outside, playing soccer and doing things and being, physically active and using their eyes and not just here.
I know.
So that was very important because it actually showed, they followed them for a long time and showed, well, if you're outside and active, you're less likely to have problems with your vision. And then the last thing, we're not really sure at this point, but lenses to help block the light off the electronic devices these days, because so many kids are on phones or tablets and computers even, and there's a blue light that is emitted. And there are some studies that show, yes, it can affect the eyes, and others that maybe not. So if you're going to spend a lot of time on a computer or on the games, then blue blocking lenses is going to be important. But personally, I think it's better to be outside and playing and letting a child develop, and letting their eyes develop the way they were supposed to. And that has been shown to reduce myopia progression.
That's perfect. Thank you so much, Dr. Mattioli, give so many knowledge. I think on the corner there have a phone number, also the WeChat, and the audience can scan. Also, if you want to make an appointment, you can call in the number on the screen. The Dr. Mattioli, 24 hours standby. 24 hours,
Sky, thank you so much. It's always a pleasure.
Yeah, thank you so much. 这就是今天的子天访谈录. I see you next week.
Thank you.